So everything looks like it's supposed to look like right now, which is where we see this hump up here. You can see probably even from last week to this week has already changed significantly. We normally will see some swelling right here in the center right here. So it makes it look like sometimes the breasts don't look as big. So this, once it starts to calm down more, they'll start to show a little bit more. And we also have sometimes the one breast is higher than the other, but you also have a shoulder that's up a little bit higher that are actually fairly even at this point. The incisions are healing well. So now what we have to do is learn how to do the pocket massage. So this is where, let's take this off right here, both these off. And so what I want you to do is take the palm of your hands right here, both of them, and I want you to touch all the way back behind your breast, right here on your ribs themselves, right here. Yes. Now when you cup your breast, what you want to do is now kind of bring your arms out like this, kind of squawk like a chicken, it's like jokingly say, and hold it here for about 3 or 4 seconds. When you're doing it correctly, it's going to hurt opposite of where you're actually touching. Since you're touching your breast over here on the sides, it should feel a little bit of a sting right here because this is where the actual muscles have been cut right here as well as down here. So you hold it there for 3 or 4 seconds, then relax, then do it 3 or 4 times and 3 or 4 times a day. Okay, so the next one is a little bit more difficult to get. So what I want you to do this time is I want you to hold your hands like this, bring your arms all the way up right here, and then we're going to go above your breast right here. Now, this is where it's a little difficult, is that you're not actually pushing downwards. What we're trying to do is relax this muscle. So what we want to do is actually relax your wrist, and you want to push towards your ribs themselves. And so what you'll feel is, once again, that sting down here. And if you're doing it correctly, if you look in the mirror, you'll see your nipple rise upwards. So once again, you want to just kind of push toward yourself, and you'll see the nipple rise, then relax, and do that 3 or 4 times. 3 or 4 times, like the same thing. It's like you want to push above them, and then see how it kind of rises up. That means you're doing it correctly. And just do that, like I said, 3 or 4 times a day. You can wear the breast straps, the bras that have the breast strap at the same time, and you can do that and use that the whole time. Okay. Now, we'll always feel like a little bit of a sting right here, because what I have to do when I go through an inframamary fold incision, I have to cut that inframamary fold. And that's like a strength layer that holds the breast and the implants in that position right there. So when I do that, I have to put in a new stitch to kind of hold it down and get it to heal there. And so that's why you'll feel a little bit of a pinch on both sides, because that suture there, until it gets absorbed, is going to be a little bit of a pinch. And it usually takes about 2 or 3 weeks for most of that pain to go away. Okay. So key thing is, you cannot see this incision, obviously. Okay. So once this tape comes off, which actually we can go ahead and take it off now because it's been a couple weeks, is you need to be cautious about any type of lifting. The most common thing that most women do when they get out of a chair is they want to push up, and you can't do it. You got to put your arms like this, kind of lift up with your legs. And when you want to get out of bed, the same thing. Use your core and kind of lift up this way. Since you can't see this incision, you have to watch it all the time. So you're going to have to check it a few times a day to make sure it's still closed and everything looks good there. Because like I said, the thing is that since you can't see it, if it opens up, by the time it opens up, it's too late. We might be taking that implant out. Okay. Any questions you have?